Hello everyone. In aphorism 6 of Organon of Medicine, Master Hahnemann advocates the concept of unprejudiced observer. What is prejudice? Prejudice is essentially an emotional reaction that is produced within a person, which is either favorable or unfavorable to the given situation. In order to become unprejudiced, one has to be aware of their own prejudices. Now this requires introspection as to why one develops this kind of emotional reaction, and secondly to balance ourselves and our emotions and to perceive the patient or the person as he or she is. Now the various tools of the standardized case record system helps us to stabilize ourselves, helps to practice analysis of the patient in a more rational way based on evidence rather than just go by the emotion or the feeling state. In the recently concluded SCR workshop on standardized homeopathic practice in association with Chhattisgarh Homoeopathic Education and Clinical Research Association at Raipur, we covered the various tools of the standardized case record system. In this, we took up 2 cases and analyzed it through the various tools of the SCR. But when we focused primarily on understanding the mind of the patient through the mental state SCR, we could understand that how the mental state SCR helps in critically analyzing the actions of the patients, the outcomes that these actions have produced, and the thoughts and the feelings behind these actions, which ultimately converge or conclude to what is the purpose of the individual. Now, to make or to understand the person through this TFCR model in the mental state SCR, one needs to constantly seek for evidences that are present in the case. Now this helps us balance our emotions or the feelings that are generated, and helps us to critically seek for evidence rather than just going by the flow. So we need to analyze what are the thoughts, then seek for evidence what are the thoughts. If a particular action is released by the patient, what is the thoughts and the feeling behind those actions? And this helps us to see the person in between the lines and to perceive what exactly he is trying to do and what is his adaptation or maladaptation. So in a similar way, all the tools of the SCR system helps us to balance ourselves, our emotions, get aware of them, that why we are responding to the person in a particular way emotionally, and seek for evidence which helps us to stabilize ourselves to understand the patient as it is. So the participants of this workshop had an interesting experience, and they could appreciate the importance of this system and the mental state SCR in order to perceive the patient. Thank you so much.